live. Fuck it. Do it live. I'll write it and we'll do it live. Thing sucks.
We are no longer physicians. We're providers.
Ask your baby's permission.
Gay people, you have become a product. Should auto insurance cover STD? Are you freaking kidding me? So you demean us. You don't get a parade for a sexual preference. To not hurt the feelings of somebody with a fraction of my training. That a beaver's ass presented this to the world. It's a natural flavor. But you are literally an ice cube in a martini shaker.
I kind of want to be an ice cube in a martini shaker.
Yeah,
that's how I feel right now.
There's days.
I've been on a rough week with the sleep, so.
Man, I didn't shave today, and look at that. I look like I could grow a beard in, I think, 15 minutes. My mic keeps moving because I have these papers from the DMV.
Well, while you get yourself organized on the show,
terrible.
I will welcome everybody.
There you go.
That's BS Free MD podcast, the Wednesday night Doctales with Cocktails version,
yes.
The X-rated, extra censored.
Tonight's going to be a little bit more on the R-rated side. Not because
not X-rated. I should say R-rated.
Yeah, because we're going to talk about a particular drug that does a particular thing that I think is particularly insane.
And its particular use is directed to the male member. There you go. So if you have sensitive ears around for the remainder.
Yes.
Just that, I think it's nice to give a little warning of that.
Yeah.
So.
But I will mock it mercilessly. You can rest assured.
Absolutely.
It's the only way you want to rest is assured.
So
you don't want to rest unassured. You want to rest.
I would like to rest.
Assured.
I would like people to comment and let us know what kind of bed they sleep on. So let me just preface this before we get into the comedy routine you're about to do. Well, it's a commercial comedy routine. Sleep, we talked about it before, how it's, one of the pillars of health, right next to diet, exercise, and I would say sleep is, for me, the next. It's actually probably the most important, behind my relationships, my faith, etc. But as far as like health journey, sleep is so important because really that's when your body does all its healing, recharge, rest. And if you're not rested, nothing else works right. Physically, you don't work right. Mentally, you don't work right. Your attitude is off. It affects your immune system. And so that brings me to my 1-year sleep struggle since we moved. And I'm not going to unpack baggage or anything. I'm just going to say we changed up what we were doing because we were devoted Sleep Number fans for years. And man, I loved it because we sleep different. And a lot of our friends said that. Some people like it softer. Some people like the bed firmer. Then it's a great thing. Other than what? Buying the twin beds that people shove together, right? With separate mattresses. You could do that. But then lo and behold, the bed was getting old and we moved and we thought we would change it up a little bit to another brand. And it's working well for one of us. But anyway, so I want to know what everybody's sleeping on because I'm in the market. There you go. Let me know. All right. While you're thinking of that and shouting out, Tim's got some fun stuff that he's going to share with you.
Yeah, we're going to talk about a couple of things tonight. Mostly a drug that's been advertised that makes my head explode. And then actually a really interesting study. I have no idea if it actually really means anything, but it's incredibly provocative.
All right.
So here we go. Safe and effective. I could watch that over and over again. It's so good. Okay, so what we're going to do is I'm going to play you a Xiaflex ad that I recorded off my television, and I'm not going to say anything. And then we're going to go back, and we're going to play it again, and I'm going to dissect it, and then I'm going to go to the actual prescribing information, the actual advertising on their website, and make your head blow up.
Oh, this is like what Steven Crowder used to do.
I have no idea.
I thought he used to do that. No.
So here we go. Here's the ad.
The bump in your erection might be painful, embarrassing, difficult to talk about, and could be Peyronie's disease or PD, a real medical condition that urologists can diagnose and have been treating for more than 8 years with Xiaflex, the only FDA-approved non-surgical treatment for appropriate men with PD. Along with daily gentle penile stretching and straightening exercises, Xiaflex has been proven to help gradually reduce the bend. Don't receive if the treatment area involves your urethra or if you're allergic to any of the ingredients. May cause serious side effects, including penile fracture or other serious injury during an erection, and severe allergic reactions, including anaphylaxis. Seek help if you have any of these symptoms. Do not have any sexual activity during and for at least 4 weeks after each treatment cycle. Sudden back pain reactions and fainting can happen after treatment. Tell your doctor if you have a bleeding condition or take blood thinners, as risk of bleeding or bruising at the treatment site is increased. Join the tens of thousands of men who've been prescribed Xiaflex. Make an appointment with a Xiaflex trained urologist. Visit bencarrot.com to find one today.
So I have to just say, I was watching that commercial. If you couldn't see it at the end, they're in a kitchen. And there's these carrots. It looks like on a chopping block, except there's one that's bent. And I thought she was like going to take a knife and hack on that thing.
Oh, I'm sure she wanted to.
Lorena Bobbitt. That's where my silly mind goes. Anyway.
No, but it's okay. We are going to go down the rabbit hole on this one because it is so completely nuts.
No.
So let's start the ad again, and I will pause it as I read the small print and start to unpack, even though I hate that word, how insane this is. Okay. And then we're going to go to the actual prescribing information and see what it actually does and what the actual risks are.
And benefits.
And we'll go from there.
The bump in your erection might be painful, embarrassing, difficult to talk about, and could be Peyronie's disease or PD, a real...
Okay, so Peyronie's disease is a scar in the penile tissue. I think it's in the cavernosum, the actual erectile tissue. And usually it's because you had a fracture. So a penile fracture, which is usually...
I get asked a lot about a bad circumcision.
No, not for this. Not in a million
so
years.
The only way to get a penile fracture, or
it's not always.
I was going to say
it can be random, but it's usually from a penile fracture.
Okay? No, I mean, how do you get a penile fracture?
Rough sex.
You don't.
Almost.
Yeah,
100%.
it's not like you don't fall on it and break it off a bicycle.
No, so unless you're riding a bicycle with a hard on and then you fell.
Well, but this is an important question because a lot of people ask because, actually.
If you want the real unbridled truth of penile fracture, it's called reverse cowgirl.
No. Okay, you're being silly because
I'm not being silly. That is exactly the highest risk position to get a penile fracture.
All right. Any other conditions that can cause painful bend during erections that aren't from Peyronie's disease? Because I do happen to know of some cases that were not related to sex.
Oh no, there's definitely non-sex cases. There's for sure.
Okay.
That's for sure. But generally it's a scar and generally it's from a previous fracture. That's the truth.
Okay, just getting it clear for people that have
do
that
guys
question.
inject themselves in the
only
penis
way you
with
can get it
cocaine?
From sex because like I said, I do know some cases where it wasn't from that.
I understand that.
Important to clarify.
I understand that. And I get that. But here we go. Let's go back to this.
Medical condition that urologists can diagnose and have been treating for more than 8 years with Xiaflex, the only FDA-approved non-surgical treatment for appropriate men with PD, along with...
Okay, so it had to be a curve of at least 30 degrees. That was the small print. Get out your protractors, boys. And let's see. It can't be 28 degrees to meet the criteria for which they studied to get this drug.
45 degrees would be a good starting point.
45 degrees.
Well, no, what I mean is
30 degrees.
It's
That's pretty significant.
It's easy to measure things that are either 180, 90, 45. You know what I mean?
Yeah.
So it's less. So it's like a third from 9. I guess. I don't know.
No, it's just wacky. 30 degrees. How do
Well,
you
at least
measure
it
that?
wasn't something like 18 degrees.
How do you measure that?
Well, I'm sure.
No. They picked 30 degrees for a reason. There's no question. There's no question. They would have picked 34 degrees if they had to. They picked it for a reason. And the reason is they picked the degrees that they knew that they could affect with the drug so that they could get approval for it.
Right.
There's no question of that. If it was 2 degrees and they can make a difference, they would have got that. There's no question. It's 30 degrees, which is like you're a freaking human hockey stick at 30 degrees. Like that's insane.
Mm-hmm.
All right, let's proceed.
While stretching and straightening exercises, Xiaflex has been proven to help gradually reduce the bend.
Okay, you have to get penile injections. They admitted it. And then you have to do stretching and straightening exercises. You may receive up to 4 treatment cycles. And next, they'll tell you you cannot be sexually active for at least a month after each treatment cycle.
Okay, so what's a treatment cycle?
It's weeks. It's like 6 weeks.
No, a treatment cycle is the injection.
They do the injection, and then it's at least a month after. And I think it's actually more than that. But
so you have to wait a month in between injections.
Yeah.
That's important to know.
And you have to do 4. So it's 4 months. It's almost half a year.
Right. And then
of abstinence.
Don't they say you have to abstain from sex during treatment?
Yes, but you have to tug your pud. I mean, you have to do
insert eye roll over here
and straightening exercises.
I am not partaking in any of this. I'm keeping my mouth shut.
I translated it different than what they said.
You're
stretching and straightening exercises.
You're the dude. You can make fun of it. I will just listen.
Here we go.
I'm not getting it.
Don't receive if the treatment area involves your urethra or if you're allergic to any of the ingredients. May cause serious side effects.
Oh, serious side effects.
But wait,
like soft tissue death. In other words, necrosis, which is like literally your penis rots off due to a hematoma. No, due to a gigantic blood clot in your wiener, which could require surgery, or it could kill you because you have a 30% bend in your man place.
And I want to know, how would you know if you're allergic to the drug? What else is that drug used for?
It's boilerplate. It has another indication, but it came after this indication.
Okay, but that's important. Like it says, don't use if you're allergic to Xiaflex. Well, how would you know?
Well, you wouldn't. It would be impossible.
So all these.
It's so that if they get sued because somebody has an anaphylactic reaction.
Anyway, go ahead.
Okay, so here you go.
Penile fracture or other serious injury during.
Okay, here you go. Signs of serious injury to penis.
This is all in the little writing at the bottom of the carrots.
No, we're reading the ad. Like if you pause this, like we're doing it, when you see it when you're watching football or in my case, NASCAR, you can read all of this. It's in the ad. It's literally in the ad. Signs of serious injury to the penis. Popping sound or sensation. Sudden inability to keep an erection, pain, bruising, swelling, difficulty urinating, or blood in urine. So
swelling, how would you? Was that
more
swelling?
That's bad swelling. It's not good.
How do you
swelling.
gauge the swelling?
It's like if your penis explodes, that's a bad thing.
Oh, yes, it is a bad thing.
That's a bad thing.
Mm-hmm.
If you can, okay. If you hear a popping sound,
hot dogs over an open fire.
If you hear a popping sound in your penis after an injection of a drug, I would think that's pretty freaking bad. Like a popping sound or sensation. I'm thinking if it makes a sound, it probably makes a sensation.
You know what I'm thinking? I'm thinking if there was the equivalent of that for women where they, gave you these injections into your boobs to try to like inflate them and you had to do this, the equivalent stuff and the risk factor was them exploding or women would be like, no way, I'm not having any part.
Well, I could probably take care of the stretching and strengthening.
Yeah.
Here we go.
erection, and severe allergic reactions, including anaphylaxis. Seek help if you have any of these symptoms. Do not have any sexual activity during and for at least 4 weeks after each treatment cycle. Sudden back pain reactions and fainting can happen after treatment. Tell your doctor if you have a bleeding condition or take blood thinners, as risk of bleeding or bruising at the treatment site is increased. Join the tens of thousands.
Yeah. The treatment site is not a treatment site. It's your dick.
Okay, wait. And there's fine print. It says as of May 2022, more than
38,000 men.
were prescribed.
That
Xiaflex.
is complete mind blower. When we go to stage 2 of this drug, it's crazy.
Thousands of men who've been prescribed Xiaflex. Make an appointment with a Xiaflex trained urologist. Visit bentcarrot.com to find one today.
How demeaning, though. Bent carrot.
Well, I know.
Why couldn't they just call it?
No, I know. They would have.
PD.com
If they would have called it, they would have had it. If it was a Canadians that came up with that, it would have been hockey stick dick. No, it depends. It's like no, seriously. It's like, oh, if you got too much of a curve in your stick, and that's keeping you in the penalty box, and you can't find the 5 hole, and shoot and score, or more correctly, score and shoot, then you need Xiaflex. You got to get a little bit of curve out of your Sherwood, if you know what I mean. If you want a good Sherwood, you got to have her less than 30 degrees. Otherwise, you're never going to hit the top corner or the 5 hole.
All right.
When you need to shoot. Like,
go.
seriously. Tell me that's not more brilliant marketing. The Canadian version of Xiaflex. Just contact hockeystickdick.com and we'll take care of you. That's right.
That sounds like a Wayne and Garth episode.
We got to
right
get
there.
you out of the penalty box and back on the ice, you big shooter.
Hey, Wayne.
I'm telling you, man. No, it's not Wayne and Garth. It's Bob and Doug. You have your genre.
You're right. I got them mixed up.
People
Bob and
confused.
Doug. Wayne and Garth. It's all the same.
That was like, yeah, that was. No, sir. Like you can't make this up, but it gets worse because you actually go to the prescribing information.
There's more.
Yeah, and they did 2 studies.
Okay, let's get.
They didn't do just one study. I'm going to do a Jordan Peterson. You know, they didn't just do one study, Bucko. They did 2 studies. And what are you going to do with your misaligned corkscrew duck penis unless you get the drug? Okay, so they did 2, and they said 2 large multi-centered studies. How large?
Yeah, how large were the
studies?
people?
Because when it comes to studies, yes, size does matter. 104 people in the placebo group in the first study and 199 in the treatment group. So almost double.
Good Lord. If you're in the placebo group and you're getting
penile injections with no medication,
saline,
you say a prayer of thanks to the little baby Jesus that they did not put this shit in your penis.
I don't know.
That's what you do.
Deserve an award.
Give
for
me the saline in my wiener.
yourself. That's
Okay.
the definition of sacrifice.
And then they did 200 in the Xiaflex arm in study 2 and 107 placebo. So basically both studies had double the patients in the treatment arm than in the placebo arm.
If someone you're
it's
signing
only
up for
400.
the study, they have to tell you it's a study with this new drug, and you might get a placebo, which means you might not get the drug, and we are going to stick a needle in your penis, and you might not get the drug.
Yeah, no, I know. But hey, like when your stick is bent, you got to get the Sherwood. So no one in the United States knows what a Sherwood is. It's a brand of hockey stick. So,
well, I think we would have figured that out by now.
Well, I don't know.
Keep going.
So
What
it's
happened with the
300
study?
people
Mhm.
in each study. It's a total of 600, and only 206 of them, or 306 of them, were in the freaking, or no, not that. 211 were in the placebo group. Okay, so the study is not large.
Okay. So what happened?
So what happened was this. So they did improvement in erectile curvature up to 4 cycles of Xiaflex from baseline to 52 weeks. And oh yeah, I am remiss in not mentioning how they inject this. How do they inject it? Well, first they have to map your penis for where the scar is, which means you have to go to the doctor's office and get an erection. And then they have to come in with a pen and draw on your penis where the injection site is whilst you have an erection. I'm not going to go into detail or detail on how they do that, because I have honestly no idea. It is the stuff of nightmares, I can imagine.
Sounds a lot like plastic surgery mapping on the skin before big plastic surgery.
Yeah, but you don't have to get a boner to get a plastic surgery.
I'm sure.
I want to get my jowls trimmed and my eyes done.
I'm
I don't have to have a boner. I'm sorry, we can't decide on how much fat to suck out of your face because you're not sexually aroused.
You know what? I'm stepping in for all the women here and calling like, you sad sucker BS men that can't take a little erection in front of the doctor when we go and spread our legs every year for this damn pap smear and that baby that invites the whole world in.
Yeah, but you're not turned on by that.
Whoa.
It's humiliating. I get that.
Listen.
I get that.
I'm sure the doctor lets you go in the little bathroom before and do your thing and look at whatever you need to look at to get turned on and then come back in. Okay. I'm sure the doctor's not helping provide the service to get you there. Stop right there.
I guess that depends on the doctor.
So I call bullshit on your little, this is embarrassing thing, because us women, and you can all comment and support me on this, have been exposing ourselves in the name of medical science and treatments and checkups and all that stuff. And it sucks. But you know what? Wah. There you go.
Nonetheless, you still have to get your erect penis mapped. I have no sorrow for you. You still have to get mapped.
It's right. If you want that thing fixed so you can have a better time in bed, and that's what it takes.
But no, just wait. But wait, there's more. So then the endpoints of the study were improvement in curvature up to 4 cycles from baseline to 52.
All right.
And
so how much did it help them?
Well, I don't know. And the reason I don't know is because it said it helped 17% and 11%. But those are relative. I'm sure those are relative risk differences, which mean almost nothing, right? So
and how much did it improve the curve by?
Well, no, they say between 17 and 11%.
Oh.
It didn't improve the curve by that. I think it improved the percentage of the curve by that.
Percentage, so 17% of 30%.
So if you're 30%,
is like
and you have and the difference, so it's 4 or 5%. If it's a relative risk difference, it's 4 or 5%. So it's basically indistinguishable, assuming that that's a relative risk difference. But it was very unclear from reading their data.
Why are 38,000 men per year?
Because they watch NASCAR.
Up to 2022 doing this.
Yes. So it's kind of like you come home after your 52 weeks of treatment and you go, can you see the difference? I can't see can you see it? Can you see it? I guess can you see the difference? Okay. But here's the more important part.
Maybe it's like those people that get all that Botox in their face and think it's making them look beautiful.
But here's the big deal. Here's the big deal. Okay. The big deal is this. It doesn't matter if you have a curve in your penis. It matters if it's harmful to your life. So if you can't have sex, if you have a painful erection, if it destroys intimacy, blah, blah, blah. Right?
Mm-hmm.
Okay. That's the only thing that really matters. Like for some people, the curve may be an enhancement. I don't know. I don't judge. But here's the second endpoint, which is significant reduction in patient-reported bother. Okay? The reduction in the bother domain score, they actually made this up. Penile bother domain score. Can you believe that this exists? We live in a nut house. We live in a simulation. Was numerically similar between patient groups stratified by degrees of baseline curvature, deformity, 30 to 60 degrees, and 61 to 90 degrees, which makes no sense to me.
Okay, no one has a bunch of numbers that we don't understand.
Yeah. Okay. The bother domain score is a composite of the following patient-reported items. In other words, completely subjective. Intercourse, erection appearance, erection pain, and intercourse frequency. Okay, like why is frequency even on there?
What does that
mean?
Like
maybe you're just fat and ugly, and that's what actually has more to do with your intercourse frequency than the fact that you have an 18-degree bend in your wiener.
Maybe some people find it unattractive.
Maybe they do. And maybe some find it very attractive. I don't know.
Oh, they were reporting that it's a problem.
Study 1 and study 2.
That's all I'm going to say.
Study 1 and study 2.
So
baseline.
basically,
okay, so N equals 109. So 199 guys.
Wait. So to wrap it up, is this thing worth doing?
It was a 1% difference in bother. There's the bottom line.
Oh, I thought you were reading all the.
No, in whether it actually affected your life, it was a 1% difference. But that was enough to meet statistical satisfaction and get the FDA to approve it, even though, get this, this is absolutely mind-blowing.
All right, keep going, even if we're having technical difficulties and went off the air for
absolutely mind-blowing when they looked at the side effects. 13% of men treated had side effects.
Oh, so
no significant side effects.
So
and I think it was
more side effects than really they had a problem to begin with.
Yeah. Okay. No, but it's 13.2% had side effects. Okay. And 98% of people in the trial had no significant pain or disturbance. So they were literally treating nothing
aesthetics
that gave you a 13% side effect ratio for a 1% difference in penile bother symptoms.
Aesthetics.
13% of people got side effects, from mild to irritating to your penis blowing up. Okay.
But you know,
but 98% of the people in the trial had no significant actual bother symptoms to start with. They were treating people that are psychologically damaged because they have a hockey stick dick.
Well, this sounds a lot like some of the other surgeries we do on people because they're psychologically damaged and want things changed. And
that's literally what that
all
is.
Kinds of trauma and
yes,
mutilation. So
that is literally
that
is literally what that is.
But they make it sound on TV that it's like a common thing and it's normal and just come on in and get this done and no big deal.
Okay.
I think that's worthy of pulling apart that study.
No, that was fun to dissect that because it is so completely insane. Like they literally say it in the prescribing information. You just click on it in the internet. 98% of men had basically no pain or significant symptoms, but they still had somebody like stretch and strengthen their penis and inject them with stuff with needles in their wiener because they had a 30 like it's just
it takes a lot of courage to do that.
No, it takes a lot of crazy,
especially the part you talked about going into the doctor's office and having to be seen with a full-on wood. So embarrassing.
As I gaze into your eyes and you
I'm
pull the needle out of the syringe.
You should have known I would have mocked that.
Load the syringe with Xiaflex.
Us women don't have any sympathy for that. Embarrassment. Anyway.
No, I've rendered
but
myself.
But that commercial is on all the time.
All the time. Okay, so here we go. This one I don't have a bumper for, but this is absolutely fascinating. So this says open label placebo injection for chronic back pain with functional neuroimaging. What in the wide world of sports?
This is a randomized clinical trial.
So what they did is they did a randomized clinical trial and they told people they were giving them a placebo. We are giving you an injection for your back pain and it's saline. It is harmless. It has no known medical effect. It has no side effects. It does nothing. And they still got better. And
I think this is really fraught with
you want to talk about, it's not like they all got better, but they got better than if you did nothing. So if you just shove a needle in someone's ass and they get better. Like, it's so crazy.
You know why they get better? Because they're like they don't want you coming at them again with a needle in their ass.
Well, especially since they've watched the Xiaflex.
Exactly. They're like, yeah, I'm better.
And they're needle phobic.
I'm
better.
better. I'm better. Get away with it.
Get that thing away from my hockey. Get from my Sherwood.
But before I get to the part, the book that I read a while ago, and it's really fascinating and speaks to this. If you're telling people that they're getting the placebo, then man, I think about it. It's like, you're like, oh, I'm getting a placebo. So some people are gonna think really hard. I mean, it's just gonna mess up your objectivity. Like it's like, well,
I'm not telling you it's
real.
Do I
still have pain, or do I not have pain? And then they could imagine more pain, or they could go, well.
Do you know where
placebo is supposed to work? That's what I've heard. So I bet you it works. I mean, this is so kind of dumb.
No, I have no idea. I'm just telling you I found this study. Do you know where placebos came from? Do you know where having to put placebos in medical studies came from?
In studies? Well, I know when they started using it when they were in the war and they ran out of morphine. And if you read the book, You Are the Placebo, you would know that. Because
and one physician observed a nurse lying to GIs with like no leg.
Yes.
Injecting them with saline and saying it's morphine, and they fall asleep and don't have pain.
Correct. Yeah, I knew that.
So
because
it's
I read the book You Are the Placebo.
So I don't know, man.
That book.
It's a complete mind bender to me.
Okay, now I gotta look it up really quick, or you can. The author. It's fascinating, and he then goes into all the history of it, all the scientific data, talks about numerous instances where people were told they had these chronic, they were misdiagnosed with medical conditions that were terminal cancers by accidents because they got the medical records mixed up. One guy's in hospital feeling unwell, and they told him he had end-stage gut cancer. There's nothing they could do. And him and his wife said, okay, no more treatment. And he basically went home and started dying, like he was almost dead. And then they brought him, that was in Asia. Then they came to America and was reevaluated. And they're like, I don't know what you're talking about. There's no cancer in your body. And so then he started to get better. And then something else happened. And they did another treatment. And it was almost the similar kind of mix up, I think. And then he got worse and died. And they did an autopsy. He died with no medical known cause because he just was convinced. And there's multiple stories about how people are in exactly what you said, studies, especially psychiatric medications, giving them placebo versus, say, an antidepressant, and they get better and they can't believe how great their life is because this new psychiatric drug is like the new wonder pill, and they've been given sugar pills. So the book goes on to talk about how the power of the mind is so powerful and how the power of the mind changes, it says, your DNA, but basically the signals from your brain do control all the nerve endings, the things that make neurochemicals, the things that stimulate your mitochondria to produce healthy cancer fighting cells and healthy, all the parts of the cells that improve your health in each individual organ system, to the point that the power of positive thinking can totally change your health. And to the extent of the opposite, that negative thinking. So if someone tells you you have a condition and it's like, oh, now I am the condition.
Yeah, no labeling. Our friend
can become much worse.
Yeah, our friend Roger McFillin, when he talks about the whole labeling of mental health.
People that have chronic fatigue.
Well, you don't understand what it's like. I have X, Y, or Z.
Or whatever. What it's like. Yeah. And
they become their disease. People become their disease.
So
that's why I don't want to call it placebo anymore. I want to call it the power of Pez, because we just put Pez in Pez dispensers and we have a different Pez head for whatever is troubling you. Like maybe a witch head for anxiety and a Ricky Martin head for like erectile dysfunction or whatever the case may be. And you just have your different Pez's with your different placebos based on the Pez head, and you use the power of the Pez.
But you have think about the patients we've had over the years. How many of them have had these diagnoses that you think there's no way, things they there's miracles that happen really when you say that, like, how on earth did they get better? A lot of the times, one thing that's in common is their attitude. They're like, I just knew I could fight this. I had a positive attitude. I did all of the things in my power as far as eating and health. But man, the power of the attitude is amazing. And so I would say that this book kind of goes on the deep end of inciting that you have all the power within you to do these miraculous things.
I don't know,
I
man.
get a little nervous about
I've known a lot of people that
I get a little
good
nervous
friends
about that. And because then it talks about how to meditate and how to change your body. But I don't know. I mean, the power of thinking that you can be better and willing it, or thinking that even from the extent of the placebo is an amazing thing.
I think it's real. I don't think it's absolute. There you go. It's real, but not absolute.
Right. So I'm not.
And that's where we get in trouble. It's like, well, it worked for Bill, so it has to work for everybody.
Correct.
Well, nothing does.
Right. So that's like, if you're not thinking hard enough and doing it right, then you won't get better. So that's
we
that's
get into that.
That's a dangerous place to go.
We got into that weirdness with certain churches. Well, you weren't healed because you didn't believe enough. Correct. Well, I thought my healing was about God, not about how much I believed. Isn't my healing God's problem, not me? Well, it's your problem. You didn't have enough faith, so you didn't get healed. And I'm like, I mean, I get it. It's a two-way street.
Well, you do need to have a positive attitude and some faith.
Well, then I'll never be healed.
No,
so, I mean, if that's...
Well, that's the whole thing about the placebo. You're thinking that you're getting some medication. So you're like, I'm getting something that's going to make me better. And you change your attitude.
I'll get my little Trump Pez dispenser.
So you need something to make you feel better.
Little Trump Pez dispenser.
Well, I'm going to fill all of those cocktail bottles with water and you'll feel so much better, right?
You're amazing. You're great. You're the best doctor I've ever seen. Take the Pez. Kamala's a whore. Like whatever, right?
I just said I'm going to fill your cocktail bottles with placebo water.
Pretty sure I can tell the difference.
And a drop of rubbing alcohol.
Pretty sure I can tell the difference.
One drop of rubbing alcohol.
Did you see how big of a more? No, it's like that little Trump Pez dispenser. Maybe that'll kill you. That'll be the
maybe that'll kill you. Exactly.
You're just pissed off all the time.
Exactly. Yes.
I'm the greatest. Everyone else is. Yeah, I don't know. We'll never know. Meme of the week. Here you go. I love this. It's not really a meme. It's more of just a quote and a truthism from William Osler, the father of modern medicine. When you look at it, he started all the specialty clinics and stuff at the Johns Hopkins. The person who takes a medicine must recover twice, once from the disease and once from the medicine. And I think what's interesting about this is we've forgotten that that's the case. We've forgotten what Paracelsus says, which is in everything there is poison and in everything there's potential treatment. Or to take Paracelsus' words and paraphrase, the difference between the poison and the cure is the dose. And we forget that. It's just like we've become so captured by this advertising, even as physicians, where we believe our own bullshit. It's like, yeah, safe and effective. Yeah, there's a drug for that. Yeah. And it's like, I'm gonna if I can find the ad.
There'd be a lot of recovering from penile injections.
Oh yeah. Yeah.
Anyway,
it's unhappy recovering. No, and it's there's a new anti drug allergy medication. I'm not gonna
anti or anti.
No, whatever. I gotta figure that one out. I want to bring that one out in the next few weeks because that one completely blows my mind. That you can advertise a drug on television that's a monoclonal antibody to treat multiple food allergies in like 20-year-olds, and no one's going, how come all the 20-year-olds got food allergies? Where did that come from? So that's for a later date. But as far as today, I think we're done.
I think you can wrap that up and put a bow on it. How about that?
All right. Till next time. I'll be out of town next week, so we might do something remote. We'll see what happens. Depends what I'm doing. It depends if I'm in a casino. Depends on a lot of things. All right. Later.